Hi, everybody, and welcome to Connect. We've got an incredibly interesting interview today with a chap called David Haddad, who originally was a remedial therapist and then went on and did training into physio. Now, David specialised in and is now currently working in the area of Parkinson's and how manual therapy can help people who suffer from Parkinson's disease. It's a really interesting interview with our president, Garry Lavis, who's also has a strong interest and a focus on Parkinson's disease with his clients. So please stay tuned, enjoy the episode, and welcome to Connect.
G'day, James here from the Health Leader Co, and I am really privileged to be able to present a session for you at the upcoming conference, which is around AI. Now, I don't know if you've seen, but I have been online recently and seen that there's actually an AI massage table. It's got these kind of paddle things that come down and it uses AI to be able to adjust a treatment specifically for the person on the table. And there's another AI robot thing that I've seen that is specifically designed to fold towels. So they use it at big hotels. A couple of these robots I saw in a video, they're just getting these piles of messy laundry and folding it into neat lines of towels. Now, actually, although those things are kind of cool, that's not at all what we're going to be talking about in this session. That might be the future to be able to help people at some point. But right now, there are actual helpful tools that you can use in your massage business to be able to make real gains as far as saving time and getting a better quality of output for yourself. Now, most of you might be aware already, or at least heard of, ChatGPT. It's a free AI that's been around for a couple of years now. We will be looking at ChatGPT specifically, but there are also some others as well that are designed to help with specific parts of your business. So yes, we're going to have a look at marketing. You can use AI to help write things like social media posts or emails or newsletters, whatever you like. But that's not the main thing we'll be looking at, although we'll touch on that. We'll also look at some of the other things you can do with AI to help save on admin time. So there's a bunch of things to do with everything from helping take treatment notes, writing up documents, if you need referral letters or if you're applying for anything like government grants, that kind of stuff. Anything that's writing, basically, we can use some amazing AI tools for. But then even beyond that, there are ways that you can do practice management things using AI that save a whole lot of time. So the whole session is really around how can we use AI in an easy way? We're going to have a look at some cool stuff, but we're going to keep it really simple and accessible. Everything we're going to look at is something you could actually use in your clinic, in your practice straight away if you wanted to be able to save time and give your clients a better experience of professionalism from the stuff you're producing. So I can't wait to see you there. It's a really fun topic, an exciting topic, and there's a whole lot of good that it can do for you and your business. See you there.
G'day, it's Greg from Judo Love Sports Remedial Massage over in Perth, Western Australia. So this is the Adma Pro. I've been using it for 6 years. I was introduced 6 years ago. Once I was bitten, I loved it. There's no way I would treat without it. We've developed a course called BMT for RMT, Bioelectric Massage Therapy for remedial massage therapists. But whether you're a physio, myo, chiro, if you're interested in soft tissue and putting energy back into muscles and seeing the response and being able to assess that before, during and after and seeing amazing results, having clients rave about you because what you're doing is different to what everyone else is, and it doesn't replace what you already know. It's a tool within your repertoire, and it just fits in and complements. And it's so important that you try it and see what you think. But the course is coming up, so give yourself a chance, but find out some more information and reach out. I'm more than happy to liaise and talk, and because I'm passionate about this, and I don't think that it should be a small group of people doing it. I think this is a game changer. The world's not ready for it, but that doesn't stop me. So take the opportunity, learn more about BMT for RMT, and be the change.
Okay, so I'd just like to say a big hello today to our membership. So I'm Garry Lavis, and I'm the National President of Massage and Myotherapy Australia. Today I've got David Haddad with me, who's done some excellent webinars on Parkinson's. And the thing that's special about this today is that that's a very much an interest of mine. Down the track, as part of the board's initiatives, my personal initiative would be like to actually develop a learning program or a learning module on Parkinson's disease as part of our certification program. So it's going to be really interesting to speak with David today and listen to what he has to offer. So David, this is special for me today too, because this is the first time I've ever been on Connect as the interviewer rather than the interviewee. So you'll have to be patient with me if I struggle a little bit, but welcome to the program, and a big thanks to you for your contribution in terms of the webinars that you've put out to our membership. So that's great. Before we get into talking about Parkinson's disease, if I could ask you a little bit about your journey from going through, obviously, a master's in physiotherapy. So if I read a little bit of your CV there, it's David's a highly experienced and dedicated healthcare professional with nearly 20 years in the industry, holding an honours degree in physiotherapy, as well as being a trained massage and myotherapist. So I'd really like to hear your story and your journey from starting out as a massage therapist to now obviously being to an honours degree in physiotherapy. Can you tell us a little bit about that?
Yeah, thanks, Garry, for having me today, as well as the team at MMA. It's been a long journey. I started when I was about 19, so you could work out my age from that. And I guess I found my niche in the health industry, and it's probably what's driven me to continue to upskill and further studies. I did massage back in Box Hill at a private college, which I actually don't even think they teach massage there anymore. And then I did remedial there, and then went on to Chisholm and did my myotherapy. And I was very eager to do dry needling back in the day. That's all I wanted to do. And I think that was just from my own body mechanics and manual handling to save my hands and back. So I thought, if I want a longevity in this career, I'll think about having some smart modalities to have part of my skills. And then I always had a soft spot for traveling, as you learnt before we started this today, that my family is international, so I had a love of traveling in that. And I kind of wanted to blend both my allied health skills with traveling, and that was my sort of first real drive to do more and upskill so I could use these skills internationally. And I was fortunate enough through you guys, or I guess as a massage myotherapist, to do some volunteered work over in Vietnam in orphanages, which was pretty fantastic and very special. And then I ended up saying, I want more. This is me. So I took the leap of faith and stopped practicing and went and hit the books for too many years and did health sciences at La Trobe University, and then went on to doing physio with an honours degree at Monash University in the lovely Mornington Peninsula in Melbourne. And I went into the sort of niche of Parkinson's because it was taught very well at Monash. Some lineage of mine, I think great auntie over in Denmark, she was living with Parkinson's, unfortunately. my grandma's brother was an eye surgeon, but his wife was also a physio. So I guess, and we've got a lot of teachers in the family. So I feel maybe just as what's innate in me to help people and to treat a diverse range of patients. But Parkinson's, there's strong evidence for intervention. And I guess that the care we can support people's living with Parkinson's is huge from all disciplines, and it really does take that multidisciplinary approach. So yeah, fell sort of head over heels in that niche area. And we do, on the broader spectrum, work in the neurological space, working with other neurological conditions, not just Parkinson's alone. And my bread and butter being my musculoskeletal skills, I feel like if you've sort of worked that out, you can sort of step into the neuro world, because you've got to have a bit of both, and there's a lot of overlap there, and even your cardiorespiratory skills too, because of the comorbidities that Parkinson's patients are living with, or could be living with as well. So yeah, that's my little bit of a story and my drive to where I am sitting in front of you today.
And how have you found, do you feel that having a background in massage and myotherapy, do you feel that makes you a better physio? I mean, the reason I say that is there seems to be quite a trend lately that physiotherapy is sort of moved to more towards exercise-based rather than hands-on that they used to be years ago. So how have you found that?
Yeah, for your first part question, definitely. I feel like I'm probably more patient-centered and take a more holistic approach. I believe the science from massage and myotherapy is shifted, and they're doing a lot more research in that space today. Where I learned physiotherapy was very hospital driven, very transfer medical training, which is fantastic because I think they go hand in hand. Even if I'm seeing a massage client, because I still treat with massage, I still have to understand the roots of the cause rather than just the signs and symptoms that we're treating. The patient-centered / holistic approach has really sort of helped me from that massage and myotherapy background for sure. And it's allowed me to work in different environments with a lot more confidence and with a lot more ease, from private practice to community, and even having the opportunity to work in hospitals or overseas. And I guess, considering my age and that ship sort of sailed to work internationally, it may still, but yeah, I definitely think I'm happy for having those roots of massage and myotherapy to get to this far in my career, because it's given me a lot of opportunity in different areas. Great question.
That's great. Okay, so let's touch on the Parkinson's disease thing now. So can you share your background and experience and what led you to treating patients with Parkinson's disease? And just, from the early stages, how were you really introduced into treating Parkinson's?
So I kind of probably touched on a little bit already, but I did, when I was in private practice as a myotherapist many moons ago, I did have some patients living with Parkinson's, and I was treating them just with manual therapy, understanding very minimal of, I guess, the pathophysiology and really what goes in this client's presentation overall. And you think, as a massage myotherapist, they come in, you get their history, you already have a pre-existing or notion of treatment, what you're going to do. As a physiotherapist, you sort of have your different lens on, or a physio hat on, where you're unpacking their whole world, not just what's going on through their fascia or their muscles, et cetera, et cetera. So I was introduced to it early, and with all, I guess, good effect, in the sense that, the client was happy, they felt good when they walked out. So I was like, great, this is quite rewarding, not just treating someone with an arthritic knee or something like that. And it brought joy, because I thought that our skills as massage therapists are more widespread than just treating someone for relaxation purposes per se. So I thought, okay. And then when I started to realize that physios don't just do massage and dry needling and a sort of sports physio, that it opened my world to this whole neuro space. And then when we started learning the science around Parkinson's, the interventions around Parkinson's, and the research out there, I really felt that we could make a difference as allied health professionals in this space. And then I was fortunate enough because we also, myself and my team, look after retirement villages, and unfortunately there are a few residents there that are living with Parkinson's, so we actually do some interventions there. And then when we started getting like pretty good outcomes, we thought this is the right fit, and we're going to continue doing that, and that's just grown. And we're getting referrals from a lot of people now just to treat with our interventions that we do. But also it drives you to stay up to date with the research in the area. And we know that the lack of knowledge and understanding of the onset and the diagnostics around that, because it's still insidious. We don't know why it's caused, and the different areas of Parkinson's, because it's such an umbrella term, that it kind of keeps me stimulated in the fact that I want to keep learning about it. If it was sort of just bread and butter and straightforward, I'd probably get bored of it, right? So
for sure. I guess it continually evolves over time, doesn't it?
Correct.
The evolution of it. There's always new studies and different things coming on board, different ways of treating it. One thing I wanted to mention to you with one of my clients is that just like yourself, I started treating him on a very manual, soft tissue sort of basis. And as his disease has progressed, he's now moved on to things like the deep brain stimulator.
Yep.
We'll talk a little bit about that later, but there's ups and downs to it. And what I found about Parkinson's, particularly from my side of things, is that it's so random. So your treatment that you give one week, completely different the next. It's
100%
change, and I think that's probably one of the hardest things to do, because you're never sort of set on any one particular type of protocol or anything like that. You're constantly changing and evolving to suit what goes on. So obviously my second question was, how has things evolved over the years? That you've certainly answered that, but can you explain how massage therapy and myotherapy can help manage the symptoms of Parkinson's disease?
So the most recent research shows around benefits around motor patterning and control, so more motor symptoms than sensory. And that may be in terms of bradykinesia, so those slow movements. And we sort of, when we think about Parkinson's, we think quite textbook, your tremors, slow movements, maybe slurred speech, etc. However, that is so incorrect. The patients we work with are so versatile in their symptoms. So we think that, and it's going off from what you just said before from your experiences, that it's so versatile. It can rapidly change, progress, regress from one week to the other, from one day to the other, that it does really take that multidisciplinary approach, right? Yeah. So we're not just thinking about the motor symptoms that the research can support, but we're also thinking quality of life as well. And there's some studies that saying that the quality of life hasn't improved statistically speaking. However, there are some research to say that it does support, because you got to think that if this patient believes that something's going to be more beneficial in part of their quality of life and their package of intervention, why don't implement that? And, that goes anywhere from relaxation to remedial to even more alternative therapies, say like Bowen's or something like that. So it really is patient dependent, and that is in turn being patient-centered, right? So I think massage and myotherapy definitely plays a role from the motor symptoms to improving function, but you could also look at the rigidity some Parkinson's patients live with as well, the stiffness, when we talk about poor posture, we know from research it's not really poor posture, it's prolonged positions, but with Parkinson's alone, we know that rigidity can occur, so that can decrease that muscle tone and allow them to be more free and have better range of motion, right? So there is definitely a role for passive treatments there. Is it the gold standard? It probably isn't from the research, but in terms of what we do with intervention, if one of our clients goes, would massage be beneficial, or they've had it and they enjoy it, I'd be recommending and encouraging that for sure. Providing it's not a contraindication to any of their medications or their presentation, right? So a quick caveat, they should always check with their GPs or the neurologist, right, just to make sure that it's safe to have massage or myotherapy done or help supported with their treatment plan. But from what we do, it's pretty safe, but you should always double check just to be on the safe side.
Yeah, I think I heard you mention quite a lot during your presentation about how your Parkinson's disease, obviously from a physical point of view, has so many symptoms, signs and symptoms, but also from a psychological point of view. Yes. So I've noticed in the clients that I treat a huge amount of anxiety and depression.
Yes,
that comes with it, and a lot of ups and downs there. So can you touch base on anything there that you've experienced in the past?
Yeah. So I just another little quick caveat that we know that anxiety and depression is such a big realm in allied health across the board to date with any condition, but specifically Parkinson's, they will potentially present with apathy or low apathy, which is mood. And they can present very vague, very fatigable, not really being engaged. So in terms of that cognition and that psychological approach, we should all as allied health professionals be taking a biopsychosocial approach. So you're really looking at the whole picture and not just treating the motor symptoms, but you got to think about all the comorbidities that we are supporting as well. It could be blood pressure, the cognition and psychology as well of that, the speech, what other factors, drooling potentially, vision loss, incontinence. Yep. So it really is across the board. And this is why Parkinson's patients are very challenging to work with, because they can present very one way or very the other way, or a very blend of a lot of those comorbidities, right?
Yeah.
And that's where you have mentioned or touched on that 1 week to the next it can be very challenging because it can be very different. So there's no golden rule to what you're going to walk in and who's going to walk into your clinic door. It's really based on how their week's been, how their mood is. And that's why the multidisciplinary approach is very required in this population for sure.
Yeah. So I just wanted to touch base. Obviously, you've been seeing Parkinson's clients for quite a long time. Mm-hmm. How do you cope starting? And obviously, you would have had clients come to you at all different levels of Parkinson's.
Yes.
Looking at a Parkinson's client that comes with sort of very not a huge amount of symptoms, and then progressing over time. Mm-hmm. How do you, as a therapist, deal with that within yourself, sort of personally?
Okay.
Obviously, you're helping them, but you're seeing them degenerate at the same time. So if I touch a little bit of my own experience on that sort of thing, yes. One of my Parkinson's clients originally came and his big toe was trembling. He couldn't stop his big toe from trembling. And so it kept banging on the top of his shoe, and he get these huge amount of blisters, and then his whole foot hurt, and then so we did a bit of soft tissue release on that, and then we talked to the GP, and we and again just touched on the base of making sure you're doing everything from a multidisciplinary point of view. Yeah. We then got a podiatrist into the equation, which looked after, braced his toe and helped him do relieve his pain with the shoe. And I think when he originally came to me to one of his most consistent symptoms, he was a runner. And he noticed that his left arm wouldn't swing like his right arm would, So I found that I've been treating clients, this particular client, from way back then to now, 4, 5, 6 years later, to the point now where he has a facial palsy. His speech is hugely affected. He shuffles like a Cliffy Young shuffle. So how do you deal with that from a personal point of view? And you've got experiences that you can share with us?
It's a great question. There are a few of our clients, depending on whom they are, how they're managed, would really, I guess, dictate how rapidly they would regress. And fortunately for a lot of our clients, they're doing pretty well to date. Yes. However, the ones that are a bit more challenging and less engaged in therapy, and you really can tell the difference, the ones that are not receiving as much support as others, they're the ones that we're not. It does take a bit of a burden on us too, because obviously we don't do this job if we didn't care, right? But we're not just supporting the clients that are regressing like that over the years. it's reaching out towards the family and their support systems as well, because they're going to be affected by that, which ultimately affects us too. So we're sort of like, it's a double-edged sword. You've got two burdens that you have to sort of hold up there. Yeah. How do we manage with it? Obviously, myself and team, we have a lot of discussions when unfortunate events do occur with our clients, ones that may even pass away. Obviously, there's open table discussions around that, because we as therapists need to have places of safe space, but also be mentally, fit to practice, we called it at uni, to be able to continue on, because it is an emotionally taxing role, what we do. And we're working with clients in all demographics and populations and so forth. So personally, over the years, I've chatted to professionals myself for my own mental health. I try to create my own support systems, like family and close friends. My staff are amazing in case I have any concerns or unfortunate events occur, so we can not bottle these things up, because I think it's really important that to be able to give to heal people, you need to be right yourself. And I think that's more probably psychologically speaking. And there's obviously professional help out there with psychologists, or even, Beyond Blue and those things out there to reach out to if anyone does need support. But my one thing that really helps me is my exercise. And I think if I didn't practice what I preached, I would probably struggle. I do get massages from time to time too, just to deload, de-stress, just my time, because I'm so busy at the moment that I think that is also makes me stressed at times. So if I can't get myself right, how am I going to help others on that continuum? And then it's just wherever the patient living with Parkinson's is on that sort of time continuum, we know that the interventions are going to be better at the start than the long run, right? Because the efficacy wears off like the medication does. Conservative management doesn't work as well. And as you touched on, deep brain stimulating, the DBS they're starting to look towards the surgical management. And what I found is that a lot of the time they put so much trust in us as therapists to give them the right answer, but it's not our call. And that's probably what I find one of the biggest challenges is supporting them without giving them what we think personally. It really is coming from a professional standpoint. And I think seeing them get to that stage in their disease projections is really just being open with them and what the expectation is on timelines, prognosis. And that way I've got a professional barrier there, which allows me to continue to go to treat rather than taking on so much of their anxiety and depression as well. So that's kind of worked for me from time to time. And I really pride on myself getting positive patient outcomes, right? So that's what also drives me to keep going too. Even if they're 10, 15 years post-diagnosis, they're actually getting quite well treated. And I, as a person, will probably never give up on a patient until it's sort of palliative care stage, really. And then once I know I can't, it's out of my scope of practice, then, another team will step in. And we've got one now going through that at this stage. And then I'm not just supporting him. I've helped set up a team, not so I don't take that burden on all myself, or my team doesn't, where they've got support workers in, they've got other allied health coming in, where they're part of Calvary now, where they're getting extra hospital-based support stuff. So we know we've done our job in the best we can. So there are strategies out there for clinicians too.
Yeah, I think it's a fact that we have to accept that, treating people with Parkinson's comes with a lot of highs, but it also comes with a lot of lows. So it's important to find that balance, in terms of that. So anyway, we're running out of time. So I just wanted to bring up one of the last questions basically is about, the research and where we're going with that. Yes. For my understanding of Parkinson's, it's the reduction through a neurological process, a reduction of dopamine production in the brain. Has there been any research? One thing I only learned recently was that the reason they called cannabis dope was because it increased dopamine within the brain. Has there ever been any major research in terms of using cannabis? I know they have done some with cocaine,
Yeah,
they Parkinson's research with cannabis at all?
They have done it, and it has shown positive signs.
Yeah.
But whether it is legalized in set countries, set cities, or states, that's kind of what it's boiling down to, and of course funding, and it's always going to come down to that. Again, caveat: I'm not going out there encouraging anyone to go find cannabis. But it's not just been using for Parkinson's, it's been using now for persistent pain as well. And I do believe there are some cannabis
PTSD too, I think that they've done studies on.
And I think they're actually opening some centres where there is legalised. You just have to get a prescription through the doctors or the GP. I know that probably not so much in Australia, because obviously we're pretty strict here and it's pretty frowned upon. But I know in the States they've done a lot of research with cannabis. But they're looking more into maybe the diagnostic side of things. They're actually researching a protein in the blood to why maybe Parkinson's is coming on, and for picking it up earlier to whether someone was going to end up with living Parkinson's or not. They're doing, so that's more medical side of things, stem cell research as well for treatment and intervention. Conservatively speaking, they're doing exogaming. So they're looking at doing functional sort of VR-based training. And we know that from some research, if you create an avatar in a game, and that's a perfect version of a sort of athlete per se, that you become that person and you start to function and move and think that way. So that's pretty exciting research coming out. And lastly, the surgical is around sort of radiotherapy, like chemotherapy, but for specifically the basal ganglia and targeting specific sites in the basal ganglia in that part of that limbic system. So there is some good research across the board, but in terms of the cannabis and specific other medication and drugs, there's still a lot under trial. And because it is, you've got to really weigh up the benefit and the harm or the risks, and of course the costs, and whom has access to this as well. And you've got to also look at the other side of the fence. Is cannabis going to mix in with the current clients' or patients' medication, and is there going to be adverse health outcomes? So there's a lot of risks to consider there. And I'm not a doctor by any stretch, so it is hard to sort of have a full synapse of that answer specifically, because a lot of it is from research. When they say a Cochrane with a database where it holds a lot of these clinical trials, they may not actually release a lot of this information directly to the public. So it is very hard to comment on that without saying anything incorrectly, as you can imagine. So,
Sure. So I just wanted to touch quickly, because we're down to a minute or so now. I've got just about the deep brain stimulator. I've done a little bit of reading, and it looks like they're sort of advancing in terms of being able to fine-tune the way it works in terms of putting sensors on the body. So when a sensor detects a tremor, it attacks that. When a sensor detects a lowering or a raising in your anxiety, it attacks that. One of the things that I've noticed with my client, the deep brain stimulator is very up and down. So it'll really help him in some of his symptoms. So like tremor has, I used to have him on the bench and he'd be all over the place, And the deep brain stimulator has improved that tenfold. But unfortunately, his anxiety goes through the roof. So it's a constant battle of trying to tune and find a medium of the two.
I've definitely found similar. A lot of the research and even anecdotal evidence shows that tremor it's quite supportive for. There's strong evidence to support that. But speech tends to be worsened from it a lot of the time, and anxiety and depression too, and even mood. A lot of patients become a bit more flat. So I'm noticing a lot of side effects, and this is where I always have these discussions with my patients about, you've got to explore all the research and even speak to a lot of people, not just make it up because the specialist is saying, it's going to be beneficial per se. I'm sure they're not, but it's really doing your homework. And there are some good papers out there on that to really understand. But I've found that most clients have had better outcomes than less, but I agree. It is very inconsistent with how someone performs post-procedure, but it is very patient dependent too. So someone's going to have better outcomes than others. And it's one of those misnomers that anything with surgery, it's a very risk. But you're looking at, patients at the 10, 15 plus year of diagnosis of Parkinson's. So don't think, if you are listening to this, that you need to rush out there and get that if you've just been diagnosed with Parkinson's or anything in an early days.
Yeah. David, thank you very much for today. I really appreciate your input, and thank you for your time more than anything. Great job on your webinars, and I look forward to a continued journey with MMA to try and put together a education protocol or that we can include in our certification program to enable massage therapists and myotherapists to have a greater understanding of treating Parkinson's disease. Because, as like yourself with me, it's a wonderful journey, and it's so broad and it's so much to learn. So thank you very much today. I really appreciate your time. Thank you very much.
No, thank you very much, and for having me too there, Garry. And I'd be happy to obviously do more talks on it, and even run workshops if you guys are looking down that road. But also happy for people to reach out. And I'm at In-Depth Therapeutics, our business, and love to people reach out if they've got any further questions.
Good on you. Looking forward to talk again. Thanks, mate.
Thanks, Garry. Bye.